Does the PRP treatment affect Radiesse fillers, which I got 2.5 months ago? I've had Radiesse injected in my upper cheeks 2.5 months ago, but I'm looking into getting a PRP treatment with microneedling. Will the PRP treatment affect the fillers in any way?
Thank you for your question. You're asking if there would be any impact on your Radiesse injections that you had 2.5 months prior if you were to undergo platelet-rich plasma treatment with microneedling. And you state specifically in your question that you had the Radiesse placed in your cheeks. Well, I can certainly help you understand what the relationship would be based on your question. Essentially, a little bit of background, I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan, Long Island for over 20 years. I use Radiesse as well as many of the other very popular fillers such as Juvederm and Restylane. And I do a lot of platelet-rich plasma treatment in my practice for a variety of issues, for everything from superficial skin complexion improvement to dark under-eye circles to scars, acne scars. It's wonderful, and it's great that you are considering this. So, in the context of understanding what Radiesse is, first, Radiesse is a suspension of something called calcium hydroxyapatite. It is a filler to add volume, and it is generally placed fairly deep. It's placed deep under the skin, and if you're placing it in the cheeks, it's placed mostly in the deeper fat layers of the cheek, so to augment and restore volume. What microneedling is being done for is to help improve the skin quality, and the PRP works very well in synergy with microneedling. We use PRP with microneedling very commonly for sun-damaged skin, for fine lines and wrinkles around the eyes, and it's a great combination. But understand that the depth of the microneedle is not likely to be anywhere close to the depth of the position of the Radiesse. The skin is basically about 2 millimeters in thickness. And so the range that a microneedling procedure can be set in terms of the depth is anywhere from 0.5 millimeter all the way to 2.5 millimeters. So, depending on how aggressive your doctor wants to be, generally it'll be considerably less than the full depth of the skin. It just depends a lot on what they're intending to do, and usually if you're doing something that's more aggressive, you might be going to what's called the level of the papillary dermis, and you'll get a little bit of bleeding, but essentially you are still pretty far away from the anatomic position of the Radiesse. And I think this is that this is actually a very good combination. In helping someone look their best, restoring volume makes a lot of sense. We do something in our practice called structural volumizing, and we were able to restore the volume in the cheekbones, the jawline, the chin. And then once that's done, the person looks great, and then essentially to improve the skin quality, options are presented such as microneedling, PRP injection, light laser resurfacing, hydrofacials, glycolic peels. You can imagine there's a lot of ways to improve skin quality. And so discuss this certainly with your doctor, but just for your own edification, it is very safe to do both. And so with that, discuss this with your doctors in terms of the plan and the outcome, but you don't have to, I don't think you have anything to worry about in terms of an interaction or any problem related. So I hope that was helpful. I wish you the best of luck, and thank you for your question.